Recently, the Times of India has released one of the news which says this sudden cardiac arrest is a myth and says by the India's one of the top cardiologists. So this report has released on April 6, 2023, and there is no sudden health emergencies. Most of the people make mistake avoiding checkups and that allow the early detection. So majority of problems is because of that the people are avoiding their regular health checkups, are not taking the proper medication. Sometimes some of the people those who are already having the pre-existing condition like diabetes, blood pressure, thyroid, obesity. So these are the people needed to be take care even much more, like they have to control their overeating, fatty oil foods. They have to regularly take the medication, and the top of that, if they cannot go for the regular health checkup. So that is the concept that we begin with the predictive health analytics that I can explain with you. They think about what if the doctor could predict your health risk before they become the problem. The problem like sudden cardiac arrest, that you have to go to the hospital going for the angiography, angioplasty, major surgeries. So kidney failure, because of that you have to go for the dialysis condition. And nowadays the very young populations are getting impacted a lot because of this situation. The type 1 type 2 diabetic is no longer confined with any age group. So while the healthcare data company, basically companies like the IBM Watson, there's a Kiva, and recently the IRA technologies, that INIGIMA Cloud Diagnosis, which basically help to uh, understand and give the conclusion based on the discoveries on the historical data. A massive step forwarding, like in order to understand my health more and more, I needed to get precise toward the patient, not the overall what is the health structure sees. So we need to understand the persona of a patient as an individual. So the data mining and this machine learning, and we are creating this particular machine learning algorithm data set. So that helps to understand the probability of getting any kind of complication in the future. So this is the completely a digital twin technology which replicate the patient data and the primary health profile, age, gender, BMI, and now after that we crunch this data and understand the trend and behavior in order to get that completely the complication which is going to be arise in coming days. So this is how the report is going to be get updated over the quarterly period, half yearly period, and it is a very simple step. Just you have to log in here. For example, for the one patient I am going to log in, and you can see how we are going to manage the data, and this data is going to be understand by the doctors very smoothly. You can see the BP, the range of BP when it's getting shoot up, and after that we are going to observe. So this is the one of the diabetic patient, and we have seen the lot of dizziness, headache, hypertension, urination problem, itching in left leg. So after that we have diagnosed with the eczema. So that is the one of the skin problem that we have identified, and you see the completely the patients are getting under treatment, how well they are getting the medications, the effect of medications we can observe completely, and we can say over the course of time whether this treatment are effective or not. So overall the things we can not just understand the future of health, we can also understand the medication process the people are going through with the doctors, and this is the help the doctor, this SaaS platform enabling to understand their patient whether the medication is affecting them a lot, affecting them in a proper way or not. So this is how it can be help the population to reduce this complexity problem. Like you have seen the lot of people, the young people are getting sudden heart attack, kidney failure condition, and nowadays the when the COVID are coming back, so you can understand this is the very important. You can take the digital screening by Enigma Cloud Diagnosis and make sure you will be live a very happy, healthy and longer life. Thank you so much.